Alright, so I have an order for NG tube placement and low intermittent suctioning for my patient Ivy Armstrong. I've gathered my supplies. Nothing is expired. Everything seems to be intact. So I'm heading to the patient's room. So.
Come in.
Hey, how's it going?
It's going good. How are you?
Good. My name is Andrew. I'll be your nurse for today.
Okay. Hi, Andrew.
Can you go ahead and verify your name and date of birth for me?
Yeah, Ivy Armstrong, 9/17/62.
Alright, Ivy, do you have any allergies I should be aware of?
Just vancomycin.
Vancomycin? Alright. So I'm going to ask you a few questions here. Do you know where you're at today?
Yeah, I'm at the hospital.
Hospital, do you know why you're here?
I've been having some stomach pain.
Stomach pain? Alright. And can you tell me what year it is?
Yeah, it's 2021.
21? Alright, I'm going to go ahead and raise your bed here if that's alright.
Yeah, that's fine.
Alright, is lighting everything alright for you?
Yep, seems okay.
Alright, so you are having some stomach issues here. So you have orders to place an NG tube. Have you ever had one of those before?
No, I don't think I've heard of that before.
Alright, so an NG tube is a tube. It's going to go in through your nose, down into your stomach, and it'll help kind of relieve, decompress some of the some pain you've been having in your stomach.
Okay.
I'm going to have to start with just an assessment of your nose, mouth, bowel sounds. Just make sure we're good to start.
Sure.
So I'm going to start with your nose here. Do you have any family history of nosebleeds, anything like that?
No, I don't think so.
Deviated septum?
No, nothing like that.
No? Alright. Can you go for me?
Uh,
Alright. No inflammation or redness. That looks good. I am going to have to check your gag reflex as well, so I can get you your eye one more time. Alright. Perfect. I'm going to listen to your bowel sounds now. That all sounded good too. And can I get you to blow your nose for me?
yeah.
Alright. And then I'm going to close one nostril. I'm just going to breathe out and we're going to switch sides. So 3, 2, 1. Alright, other side. Alright, so I think we will go ahead and use your right nostril today.
Okay.
So I am going to clean off the bedside table and go ahead and set everything up, and we'll go ahead and get started.
Okay, yeah, that seems good.
Do you have any family coming to join you today?
No, not that I know of. I don't think so.
Alright. Clean this off, make sure everything's staying clean here. Are you comfortable in that position, Ivy?
Yeah, it's fine right now.
Yeah, okay. You have to keep it elevated. It'll help with the insertion of the tube and everything.
Okay.
Alright, is that alright for you to set your bed here?
Uh-huh.
Alright, I'm just going to go ahead and get all my supplies set up before we start here.
Okay.
I'm going to place this towel over here, right here. And this basin is for you just in case. The procedure today can be a little bit uncomfortable, can cause you to gag. So that's there just in case you need it.
Okay.
Alright, Ivy. I'm going to go ahead and measure the length of the tube we'll be needing here. Start at your nose here, go to your earlobe, and down to the bottom of your sternum, right there. And that is right about the length of tube that will be inserted. Alright, Ivy. So I'm gonna go ahead and lubricate the end of this and we'll get started.
Okay.
Like I mentioned earlier, can be an uncomfortable procedure. So if at any point you feel any pain, discomfort, you want to gag, anything like that, go ahead and raise your hand to your finger to signal me.
Okay.
And also here is a glass of water for you. Don't worry about that for the first section. I'm going to insert the first 10 to 15 centimeters. And after that, I'll have you sip the water. And as you sip, I'll be inserting another inch or two. And that'll just help make sure it's in the right place, help with the discomfort, everything like that.
Okay.
All right, you ready? 3, 2, oh, sorry. Before I get started, tilt your head back. That'll help make sure the tube gets in the right place.
Okay.
So 3, 2, 1. All right, and then I'm gonna go ahead and have you tilt your head forward. And then I'll say sip, and I'll just keep inserting it till we're there. All right, ready? 3, 2, 1, sip. 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 All right. How's that feel, Ivy?
Yeah, it feels alright.
Does it feel alright? You can still breathe all right?
Yep.
Don't have any obstruction in there? All right. So we are going to go ahead and check to make sure we're in the right place here. So I'll withdraw 5 milliliters of the gastric contents. And then I will check the pH. Alright, so that appears to be a pH of 2, so we are good. Go ahead and get this stuff out of the way for you. I'm going to secure it a little bit better here. Alright, how's that feel, Ivy?
Yeah, it feels good.
Feels good? Alright. So right now your bed is in a 30-degree position here. We don't want to go below that. It does put you at risk for aspiration. So whenever you have your NG tube inserted, you're going to make sure you're staying, 30 degrees or above.
Okay.
So I'm going to go ahead and get you sent off to radiology. I'll lower your bed here for you.
Okay, thank you.
And then I'm going to get cleaned up. And I will see you when you get back from radiology. And we can go ahead and get the sectioning started as long as everything's good.
Okay, sounds good.
All right. I will see you soon, Ivy. And Ivy returns from radiology, so I head in the room.
Come in.
Hello, how's it going?
Yeah, it's going good. How are you?
Good, good. All right, can you verify your name, date of birth?
Yeah, Ivy Armstrong, 9/17/62.
Okay, I was Andrew. I was in here with you earlier. So we did get your results back from radiology. Looks like everything's good.
Okay, that's good.
Tube's in the right place and all that. So I'm going to go ahead and raise your bed for you.
Okay.
So we will be starting the sectioning with your NG tube here.
Okay.
If at any point you feel any discomfort or pain, feel free to let me know.
Yeah, I can do that.
Alright. Okay. I'm gonna go ahead and turn it on and just let me know
Okay.
if you feel any uncomfort, anything like that. Alright. Feel alright?
Yep, feels
Yeah?
okay.
Okay, now I am going to have to listen to your bowel sounds just to make sure. Alright. There's no bloating or anything. Alright, I think you are good to go. I'm gonna lower you back down.
Yep, thanks.
So everything feels comfortable all day?
Yep, feels great.
Yeah. Alrighty. I am going to go document what we did here today, and I will be back to check on you in an hour or so. If you need anything, call lights right here. Are you comfortable? Lights good? Everything?
Yep, everything's fine.
Yeah? All right, I'll be back to check on you in an hour.
Okay, thank you.